Welcome back, my people. As I always do, it has been my tradition to appreciate you guys before I start any video because you have been of big help to this channel. The growth I'm seeing it in this channel, it's all because of your support and your willingness to support me with my content. So for those who are supporting me, those who are subscribing, and those who are liking, those who are commenting, whatever you are doing in this channel, be it viewing, without even commenting, I do appreciate a lot, because without you, I could not have been where I am at the moment. What I always beg you people, let's continue subscribing, let's share with our haters and lovers, so that this content, all what we are doing, can help the community at large. And I do appreciate those who are benefiting from what we are doing. That means our efforts are being recognized by majority of the people in the society, and we do appreciate that. So let's get back to our topic. And if you have not subscribed, consider doing so, and make sure you put the notification bell on, so that whenever I produce any video, you will never be left behind, because YouTube will automatically notify you. So we are still discussing about vomiting, and in this video we will start by checking on when to see a doctor when you are suffering from vomiting, or when you are having vomiting. And let's start by discussing adults and babies. Adults and babies should see a doctor if they, one, are vomiting repeatedly for more than a day. Vomiting repeatedly for more than a day. Number two, adults and babies should see a doctor if they are unable to keep down any fluids. So this means the baby or the adult can't retain anything. After swallowing, he or she throws up. So in this situation, you should see a doctor. They should also see a doctor if they have green colored vomiters, or the vomit contains blood. Bloody vomiters or green colored vomiters. Number four, they should consider seeing a doctor if they have signs of severe dehydration, such as fatigue, dry mouth, excessive thirst, sunken eyes, fast breathing, fast heart rate, and little or no urine. Those are dangerous signs of dehydration, and the complications are more worse. So see your doctor, or take your child to a health care provider if you see these signs of dehydration. For example, fatigue, dry mouth, excessive thirst, sunken eyes, fast heart rate, and little or no urine. A point to note: in babies, signs of dehydration or signs of severe dehydration also include crying without producing tears and drowsiness. Crying without producing tears and drowsiness, or being sleepy always. Adults and babies should see a doctor when they have lost significant weight since the vomiting began. Losing significant weight or decline in weight since the vomiters began. They should see a doctor when the vomiting is on and off for over a month. On and off for over a month. Let's discuss about pregnant women. When should they see a doctor? If you are pregnant and you are vomiting, when should you see a doctor? So Pregnant women should see a doctor if their nausea and vomiting make it impossible to eat or drink or keep anything in the stomach. In short, they are not retaining anything in the stomach. Let's talk about medical emergencies in vomiting. What are the medical emergencies in vomiting? Vomiting accompanied by the following symptoms should be treated as a medical emergency. Get this right. Get this right and clear. That vomiting accompanied by the following signs and symptoms should be treated as a medical emergency. Number 1, vomiting accompanied by severe chest pain. Vomiting accompanied by severe chest pain. Number 2, vomiting accompanied by sudden and severe headache. Vomiting accompanied by sudden and severe headache. Number 3, vomiting accompanied by shortness of breath. Vomiting accompanied by shortness of breath, or in other words, you can call it labored breath or difficulties in breathing. Number 4, vomiting accompanied by blurred vision. Vomiting accompanied by blurred vision or inability to see clearly. Number 5, vomiting accompanied by sudden stomach pain. Vomiting accompanied by sudden stomach pain. Number 6, vomiting accompanied by stiff neck and high fever. What is stiff neck? Neck that remains in one position and it's very stiff to an extent that you can't turn it. That is what we call stiff neck. So if you have vomiting accompanied by stiff neck and high grade fever, you should see a doctor. And you are pregnant, sorry. If you have vomiting accompanied by stiff neck and high grade fever and you are pregnant, see your doctor. Number 7, vomiting accompanied by blood in the vomiters or bloody vomiters. I hope you get all those points clearly. A very important point to note. Very, very important. Infants or younger children, infants younger than 3 months who have rectal temperatures, infants or young children, infants younger than 3 months who have rectal temperatures. Remember, we can take temperatures from the axilla or axillary temperatures, rectal temperatures, or oral temperatures. So this point insists that infants younger than 3 months who have rectal temperatures or fever of 38 degrees centigrade and or higher, with or without vomiting, should see a doctor. This is very important. Infants younger than 3 months who have rectal temperatures or fevers of 38 degrees centigrade and higher, with or without vomiting, should see a doctor. This marks the end of our second video today and the discussion of today. And in our next video, which is tomorrow, we'll be discussing about prediction and prevention of vomiting. Can you predict when to vomit? And how can you prevent vomiting after predicting? So guys, thank you for your time. Thank you for supporting me as a family. I do appreciate everything. And today, as I have seen the numbers, we might click 10,000 subscribers. and you promise me before the new year we will have hit 10,000 subscribers mark. I have confidence in you and I know you are doing marvelous. Let's have a good evening and meet in our next video tomorrow. Have a wonderful evening.